Hello, and welcome to my presentation about Giardia and the very yummy lake water that can give you Giardia. To start off, we'll talk about what Giardia is. Scientific name Giardia duodenalis or Giardia lamblia, also known as Giardia intestinalis, is a protozoa. Its phylum classification is Sarcomastogorophoa. It has specialized structures like metabolic enzymes called ADI that produce energy under anaerobic conditions. This is because it lacks a Golgi apparatus and a mitochondria. For what it lacks, it makes up with 2 nuclei with identical DNA and 8 flagella, 4 pairs in total. Giardia's life cycle exists in 2 phases. 1, the cyst phase, and 2, the trophocyte phase. In the cyst phase, this is where it is environmentally stable. It is found in fecal matter as well as water and food that has been in contact with contaminated water, as well as soil and air in this cyst form. Once it enters the small intestine, then it is able to become the trophocyte form. The cyst will split off into 2 through binary fission and become 2 separate trophocytes that can then continue to reproduce. In the US, Giardia is primarily contracted from drinking contaminated lake or stream water. It's often seen at the end of summer as a lot of people are going camping or out in nature. In developing countries, it's a lot more common. It's found in a lot of drinking water and then food that has come in contact with contaminated water. The incubation period lasts about 7 to 14 days after you've ingested this contaminated food or water. The cyst is swallowed and it's going to pass through the GI tract and it's going to become the trophocyte in your small intestine. So like I was saying earlier, they reproduce through binary fission, and then when they pass out of your colon, they'll turn back into cysts, and that's how the infection can be spread through fecal matter. Some signs and symptoms of Giardia include watery and foul, distinct smelling diarrhea. This can alternate with soft, greasy stools. This is because it impacts your nutrient absorption, so you're not absorbing fat and you'll be passing it. You'll also have fatigue, gas, stomach cramping and bloating, and subsequent weight loss. These symptoms will last 2 to 6 weeks. So what's happening inside you when you have Giardia is there is a damage of the brush border of the epithelial cells in your small intestine. So the microvilli, which is what covers your small intestine and allows for a lot of surface area to promote digestion and absorption of nutrients, that is impacted by the Giardia protozoa, and that parasite is going to smooth out that area and lessen the amount of surface area, so the absorption is then in turn lessened. The frequency of this disease in the United States of America specifically, it is the second most common intestinal parasite after pinworms. It has a 2 to 5% infection rate. It's most common in late summer, like I was talking about, and then children are often most commonly seen with it. And that is true for both the US and in developing countries, where it's more common in cities, and it has a 20 to 30% infection rate. It's the first most common intestinal parasite worldwide. And then globally, only about 0.25% of all who are infected with it will die. So you got a pretty good chance of beating Giardia. The sources that you would find it in are going to be the soil, water, and air. From there you have contaminated food and water. Like I said, it's spread through fecal matter. Transmission, often contaminated water, contaminated food, poor hygiene, like washing produce with contaminated water or not washing produce. From person to person, you see it through poor hygiene, often not washing hands after using the bathroom, changing dirty diapers, and then it can also be contracted through anal sex or oral sex as well. Prevention. There is no drug or vaccine that can prevent it. However, good hygiene, hand washing. What's interesting is that alcohol-based sanitizers are actually not as effective at killing Giardia cysts, opposed to like a antibacterial hand soap. You want like purifying your water, and then washing your produce with that purified water will also help prevent Giardia. If you do contract it, there is a couple options for treatment. You have antibiotics, so there's a couple listed here. The most popular one is going to be metronidazole. That guy's a multiple dose. You also have a single dose option for the antibiotic and a liquid form. That one's often prescribed to children. However, with pregnant women, they do not recommend the antibiotics as they are likely to cause harm to the fetus. So what is often recommended is like a high fiber diet and monitoring the infection. So the tests that can identify Giardia are going to be through a stool sample. This is so you can look for the cysts. There's a couple different options. There's the DFA and the ELISA, and then a PCR test as well. So there's a couple different ways that they can test the stool for Giardia. And then while I was looking, most of the data that I found was pretty set in stone. However, I did find a really interesting article about treating Giardia through a combination of antibiotic and holistic approaches, so traditional and holistic, kind of promoting like a high fiber diet, probiotics and prebiotics, while also to help heal the gut after the antibiotics, given that the gut bacteria is so diverse and so helpful in your absorption of nutrients that you need to take care of it. So that was pretty interesting. And here are my citations. Thank you so much for listening to my presentation, and I hope y'all have a good rest of your day.